Here's a question in terms of the quantitative aspects of the research pertaining to Muslims in America. Obviously, we know that there is no set number. We don't know exactly how many Muslims live in America. Because of what you had just stated. We don't know how many Arabs or Iranians or what have you of the different groups um, are in the country. And so, one, how does that affect your research? And two, I mean, yeah, you said you're coming up with other ways to try and quantify data. Is this, which is pretty creative? I mean, that sounds very creative. Is it are you able to use that data in as effective a manner as if you had the actual figures, like official figures?
So a couple of things on this. It kind of goes both ways. So one, you have to be creative because there's no official figures. And even beyond something like the census, which is our closest thing to like an official count. And there was a big debacle with the census data collection in 2020 around Middle Eastern and North African communities. And we can talk about that further, but basically the decision was made not to collect that identifying information. And so what happens is a lot of the survey information, so they take a sample of the population and they survey them, is based on the census racial and ethnic category. So even the nationally representative survey data that we have doesn't really capture religion. It doesn't capture Middle Eastern and North African categories. And so you have to be really creative. And I've used some national data that we have to like do some of my work, but again, you often don't know within the Arab community who is Muslim and who is not. Same thing with the Iranian community, even if you can identify those communities. The other side to this is within these communities themselves, there's a certain amount of vigilance and I don't know, like lack of desire to reveal your identity because of experiences of hate and discrimination. And so on a research side, for me, it's a constant battle between, do I push for identifying these communities? And how do I do that in a way that sort of, there is a certain level of paranoia now in all of our communities about revealing that kind of information, or, you know, it's kind of a 50-50 split about people who want to be on the census versus not because they prefer to be hidden. And so that's a result of the discrimination as well.
Well, I mean, this is not a new, in my understanding, this is not a new situation. Like the reason that Arab Americans are considered Caucasian on the census, they campaigned for it because it was in the 1920s or so, around then, that they, during like Jim Crow laws, that they didn't want to be classified as non-white. So they campaigned to be considered Caucasian, but now it makes them basically invisible on in the census as a distinct community. And then also, like today, I think there's just a paranoia about talking to the government whatsoever and identifying yourself. And I understand the logic for each of those you know, impulses and those movements, but it does make it very difficult to quantify those populations and demographics.
Exactly. Well, and that's 100% correct. Like this movement for being included in the white category started really early on, and now I would say the communities are pretty divided. Part of the problem is that their lived experience is that of a minoritized community, right? So most Arab and Iranians and other Middle Eastern groups are not walking around the United States being treated like white people. And so I think that that's where the debate comes into play. And it's really, really tough as somebody who wants to advocate for these communities and have resources allocated to these communities to then not have the official count, but it's also equally respectful to not want to reveal your identity based on the experiences and want to remain a hidden population. And so as part of the respect for the community, I also hold that really, really closely.
Well, I have a friend who he's an activist in the Arab community here in Southern California, and any sort of political issue that pertains to the Arab community, he's pretty much at the forefront of that. And so he was very active in campaigning for the prior to the census, the 2020 census, to get those categories recognized. And he was going around the community and informing people and doing all the legwork, right? And telling people that, hey, yeah, we know of the paranoia factors. We know of also some of the issues that people have that they've carried along with them from, you know, a lot of them from countries where they come from authoritarian regimes, right? Where they're terrified of identifying themselves and being monitored by intelligence services and what have you. But what he was saying is that, you know, ultimately, this is such a hotly political issue, in that, as you just mentioned, a huge amount of government funds and resources would be dedicated to, let's say, the Arab American community or the Iranian American community or other communities. And those funds, those resources could be used in so many ways that could benefit those communities. And it seems like, I mean, I can see also from your angle the public health aspect, but then there's so many ways that these communities are held back. And it seems like it's just this concerted effort, you know, to keep doing that. I don't know if it'll turn around in the next census, if things come around, you know. But
yeah, it's happened like every census for the last like 30 years. So I was really hopeful for the 2020 round. I thought that it was finally going to go through. And so because of a lot of those grassroots efforts that you're talking about, because of a lot of the information sharing around what it means for resource allocation for these communities. And unfortunately it didn't. And I think it ultimately didn't. There's like 100-page report out of the Census Bureau about, you know, everything they did with piloting these measures, and basically all their evidence shows that it was useful for these communities to have this categorization. And then ultimately it didn't move forward. And I think that that was very politically motivated and outside of the research that shows that the utility of actually having that additional category.
Well,
right.
Here's a question outside of the academic world, because I mean that's the orbit that you're working in. How does your research how does that translate into impacting policy?
Sure, it's a great question. So my first realization that this argument that anti-Muslim racism leads to poor health was an academic argument that the public could not fully grapple with was when I wrote the original piece on this in 2016, because I also published an op-ed in order to, a lot of times with like pushing policy forward, you have to not just publish an academic article, like certain people care about that, but not everybody does.
No one reads academic
Right.
articles except for academics.
Right. So you have to publish op-eds or policy briefs and things like that, and really connect then organizations that are doing policy work to your work to move it forward. And so I wrote an op-ed, and then I received the most hate mail and death threats and Islamophobic directed like hatred that I've ever received in my life following that op-ed being published. And my argument is very simple. Like, it's we know that racism affects health. We have decades of research in the health space that shows that. Muslims are people too, and so racism against Muslims affects their health as well. That's the whole argument. And people just the public could not get on board with Muslims are people too. That piece of the argument really was triggering for a lot of folks. And my family received hate. The FBI had to get involved. We had to stop checking our mail. It was quite a fraught situation, but a learning experience for me, which is that the academic argument is one thing, the public opinion argument is another thing, and then the policy effort actually involves taking all of that collective information to organizations that are doing this policy work, both at the local levels, because even in states we have like anti-Sharia legislation, and one thing I look at, for example, is states that have more like anti-Sharia bills being proposed and passed versus states that have less, and thinking of those states that have more as more hostile towards Muslims, and using that sort of structural information to look at Muslim communities in those states and their health outcomes. And so there's a lot of policy effort that can take place at multiple levels, and a lot of it is getting the research in the right hands or partnerships with organizations that are doing the policy work.
Well, you're up against a lot of morons.
Yes,
like anti-Sharia laws, it's like you don't even know what that is.
Exactly. I have to always explain to people like where that
like
movement
what Sharia
growth.
is.
Yeah.
What it even means, and
right.
and no one's imposing this on you. And don't worry, the Taliban is not in your neighborhood. Calm the fuck down.
Exactly.
Well, there is something I wanted to ask, which is, I mean, obviously your focus is on the US, but clearly there are a lot of similarities in other parts, like other Western countries, the UK, the Netherlands, what have you. Are you seeing
France?
France, of course, yeah, of course. Are you seeing that, there is more possibility for the kind of work that you're doing, and the things you're pushing for here as opposed to Europe? And like, what are the similarities? What are the differences that you see?
Yeah, so my work is really moving in a sort of comparative direction, I would say. So bringing in some additional country context, comparing. A lot of the theoretical work is applied now. People who are sort of extending my work are looking at European contexts and how they vary or confirm. I have collaborators, for example, who focus on Australia as another case. So it's both moving in the comparative direction, I would say, like also in the demographic age group. So like, what are the implications for youth and the elderly? And so thinking about it like that too. So it's going to be a lifelong effort, I think, but for sure, Islamophobia is not limited to the US. I would say China and India are like global leaders in Islamophobia. And so that it's important to really kind of continue to elevate that it's a global phenomenon.